In this video, we are going to learn about sterile dosage forms. Parenteral preparations are those pharmaceutical products that are given by other than oral route. The name parenteral itself indicates that para means other than, enteral means intestinal. So, these are the preparations which are needed to be given other than intestinal route, that is oral route. So transfusion fluids and the injections are the parenteral preparations. Injections are the sterile solutions or suspensions of a drug in aqueous or in an oily vehicle meant for introduction into the body by using an injectable needle or through one or more layers of the skin or mucous membrane. So here injection should be sterile in nature, they should be isotonic, they should be free from foreign particles such as dust and fibers. Why this much sterility is needed for this type of preparation space? As they are directly reaching to the systemic circulation here. So they should be very sterile and isotonic in nature. And they should be introduced through the same route for which they are intended. For example, an oily suspension meant for intramuscular injection may be very dangerous if it is administered by intravenous route. Similarly, some potent drugs which are required to be given through the intramuscular injection may prove some very fatal problems if it is given by intravenous route. So what it indicates means those preparations should be administered through the same route for which they are intended. Okay, is it clear? So this is about the parenteral preparations. Under this we are going to learn about the various advantages, disadvantages of the parenteral preparations. At the same time, what are the different types of routes of administration of parenteral products, types of parenteral preparations and general requirements for the parenteral dosage forms and formulation along with processing of the parenteral preparation is needed to be studied under this topic. Advantages of the parenteral preparations. Compared to other routes, it has a quick onset of action. That is the first advantage. And the second one is the drug which cannot be administered by oral route can be administered by this type of routes. At the same time, the patients who are vomiting or unconscious cannot take a drug by oral route. So in such cases, the drug can be administered by this route. And another advantage is the drug action can be prolonged by modifying the formulation. Another advantage is transfusion fluids containing nutritives like glucose, electrolytes such as sodium chloride can be given by this route. So these are some advantages of the parenteral preparations. And next one is the disadvantages of the parenteral preparations. Here injections causes some pain at the site of action. That is one disadvantage of this dosage form. And the trained persons are required to administer the drug. And the administration of a drug through wrong route of injection may prove to be a very fatal. It is difficult to save a patient when a overdose is given. And there is a chance of sensitivity reactions or allergic reactions of a drug by an individual. So these reactions are sometimes very fatal and lead to death. So these are all some disadvantages of the parenteral preparations. Routes of administration of parenteral products. So there are various routes of administration of parenteral preparations are there, like intradermal injections, hypodermis injections, intramuscular injections, intravenous injections, intraarticular injections, intracardiac injections, intrathecal injections, peridural injections, intraarticular injections, intracerebral injections, intraarterial injections. We will see one by one clearly. Intradermal injections. These are also called as intracutaneous injections. Here these are given in between the dermis and the epidermal layers of the skin. The skin of the left forearm is usually selected for giving the injection. Generally 0.1 to 0.2 ml of the parenteral solution is injected by this route. The route is used for diagnostic purposes and for testing the sensitivity of the injectables. And next one is hypodermis injections. These are also called as subcutaneous injections. So these are made for under the skin into the subcutaneous tissue. The volume of 1 ml or less is usually injected into the upper arm. This is the most popular route because it is convenient for the patients and the doctors. And the next one is intramuscular injections. These injections are given into the muscular tissues. The muscles of the shoulder, thigh or buttock are usually selected. Generally, volume up to 2 ml is administered by this route and should not exceed 4 ml at one side. Aqueous or oily suspensions and oily solutions can be administered by this route. And the next one is intravenous injections. These injections are made into the vein and therefore introduced directly into the bloodstream. The median basic vein near the anterior surface of the elbow is usually selected because it is easily located and connects with the major vein of the arm. Large volume of the parenteral solutions ranging from 1 ml to 500 ml or more than that can be injected by this route. The parenteral solution should be isotonic with blood. If the volume of more than 15 ml should be injected. The suspensions and oily injections cannot be introduced by this route. And next one is intra-arterial injections. These are similar to the intravenous injections and are occasionally used for an immediate effect in peripheral area. These injections are given directly into the arteries. And next one is intracardiac injections. So these are given into the heart muscles or ventricles in an emergency only. For example, as a stimulant following cardiac arrest. And next one is intrathecal injections. These are made into the subarachnoid spaces that surround the spinal cord. This route is used for giving spinal anesthesia. And next one is peridural injections. So these are given between the dura mater and the inner aspects of the vertebrae. So it is that portion of the vertebral canal not occupied by the dura mater and its contents. This route is sometimes used for giving a spinal anesthesia in a special cases. And next one is intra-articular injections. These injections are given into the liquid that lubricates the articulating ends of bones in a joint. And next one is intracerebral injections. These injections are given into the cerebrum. It is a special type of injection. Types of parenteral preparation. Parenteral preparations can be classified as follows. Here they should be as in a solution form or a sterile solid form or maybe sometimes a sterile suspension or otherwise as a transfusion fluids. Here the first one is the solutions or emulsions of medicaments suitable for injection. Here these are the commonly called as injections. So the parenteral preparations in this form may be supplied in a single dose container or a multiple dose containers. Its volume varies from 0.5 ml to 1 liter. Example is atropine sulfate injection, dextrose injections. So these are nothing but some sort of normal type of injections. And the next one is a sterile solids. So here the drug which are not stable in a solution are prepared and supplied as a dry sterile solid form which are dissolved in a suitable solvent immediately before administration. Example benzyl penicillin G sodium injection. And the next form is a sterile suspension form. Here these are the sterile suspension of a drug in a suitable solvent which are administered by intramuscular route. Example sterile hydrocortisone acetate suspension, sterile chloramphenicol suspension. And the next one is transfusion fluids. So these are the parenteral solutions which are administered by intravenous route. So they are generally used for nutrition and to maintain the electrolyte balance. Example, Ringer solution, dextrose injection, sodium chloride injection. So these are all the types of parenteral preparations. All these are the parts of the syringe. It has a cap, needle, barrel and plunger. These are all the types of the needles. Thank you for watching this video. Please subscribe to our channel for more videos.